We're streaming live. Welcome everyone. It's Julia Mejia, at-large city councilor, and really excited for today's panel. It's May 1st, May Day. So talking about all things labor and the importance of uplifting the voices of the people. We have an amazing panel lined up for you today, and we're just gonna go around. I'm gonna start off like I said that I would. I'm going to call out your name. You're going to introduce yourself, the organization that you represent, and a surprise question. Okay. And before we introduce our panelists, I want to introduce my sister in service, the one and only Counselor Lydia Edwards, who, as you know, has always been a friend to the labor movement. And I like to call her a beast at what she does, because nobody does it better than Lydia when it comes to serving the rights of our people. So Lydia, the question of the day is going to be, if you could only eat one thing for the rest of this stay-at-home order, what would it be?
Candy.
Yeah.
Candy. Me and sugar have a bad romance, and so I stay on the pixie sticks, the lifesavers, candy. Nothing healthy. Sorry.
No, it's all good. And you want to tell everybody what district you represent?
I am proud to represent District 1, which includes the North End, Charlestown, and East Boston.
Thank you. Now I'm going to go next to, I'm going to ask Roxana. Please introduce yourself.
So I'm Roxana Rivera. I'm the Vice President of the Service Employees International Union Local 32BJ. And the question?
And if you can only eat one
keep it
thing,
simple.
Yeah.
Huh?
If you can only eat one thing for the rest of your life, what would it be and why?
I keep it simple, rice and beans, because that is comfort food for me. So I'll keep it simple.
Thank you for that. I'm going to go to Darrin.
Yes, Darrin Howell, thanks for having us today. 1199 SEIU political coordinator. And if I had to eat one food for the rest of my life, I think I will eat a peanut butter and jelly sandwich. I think that can't go wrong with that type of simple sandwich, and it's always fulfilling.
I'm going to go next to Janine.
Hi, it's Jeannie from Boston Medical Center. I'm also a delegate of SEIU 1199, and I have to say Twinkies.
Oh.
What is she? Twinkies. Wow. Okay. Did she say Twinkies?
Yeah, love them.
Oh, find out. Okay. I'm going to go next to Fernando.
Yes, hi, my name is Fernando Lemus. I'm the president of Local 1445 United Food and Commercial Workers Union. And we represent about 13,000 members in Massachusetts, New Hampshire, and Maine. And if there was one food that I would eat the rest of my life, probably if I was quarantined, would be pupusas.
So we're all going to go on a picnic, right? Because I think we all brought a little bit. We got the sweet, got the starch. We're good. So we're just going to get started. I would love for folks to, those who are tuning in, to get a real sense of, when we're looking at what has happened, how COVID-19 has impacted your membership and just our daily lives. Would love to hear from each of you what that has looked like. I'm going to go to Roxana first.
Yes,
Just
thank you.
Yeah.
So we, our union represents 20,000 workers that work as janitors and security officers and other maintenance workers at colleges and universities, in office buildings, at the airport. And we've, because of the nature of this virus and the need for cleaning, right? Obviously, our workers that are cleaners and security officers, they've been on the front line. They've obviously they live in, the majority of our members are people of color and immigrants, and so they've been, the communities in which they live have been the hardest hit. So we have unfortunately had some members pass away in the last couple of weeks, given COVID-19. We have hundreds of members that have contracted the virus at work. We've also had thousands of workers actually be laid off, and sometimes with only a day's notice. Those are, so it has been very, both what has happened to people, but also the way it's happened, that has happened so quickly, and it doesn't even give people a chance to even absorb what's happening to them and even prepare any, for what the challenges are. So it's been very difficult for folks. There's a high level of anxiety. Those that, the majority of workers, like hospital workers and grocery workers, are on the front lines, and our essential workers, they are showing up to work. They are concerned about their own safety. It has been a struggle. It's getting a little bit better, but it's been a struggle to get proper protective equipment, and also the issue of just having protection, even getting the sense of essential pay, right? Because people are being asked to come into work, again, they feel like they're risking their own safety and what they could bring home to their families. And for folks that are for workers that are undocumented, it's been really harsh, because they are faced with the same situations of contracting COVID-19, or having to be laid off, and they don't get to take advantage of the governmental programs like unemployment. So that has been very difficult. I had our members live in mixed households where you have, citizens, you have residents, you have people with TPS, you have people undocumented, they're all a family unit. And so, whereas, people rely in their household as one family unit. And so it really affects the whole family. And so so we've, faced those challenges, and we continue to do them. For the folks that are undocumented, what we've seen is that, some of the issues that we were raising even before the pandemic, like the right, to have a driver's license, right? We see how even in the light of this pandemic, how that is something that's important, because folks, want a social distance. If the only way that they can is through being on a bus or being, on the subway, and not have the opportunity to, be in a car, that has also impacted people. So it just, we're redoubling our efforts, even in the midst of this, to basically say to the state that we really need to give the access to a driver's license to all immigrants, and it shouldn't be tied to their immigration status, their federal, immigration status. So.
Thank you for that. I'm gonna go next to Fernando.
Mm-hmm. So yes, so this came down so suddenly, right, that we were not ready. It was just a year ago that we were, our UFCW was on strike with Stop and Shop, and we had over 32,000 workers out on strike, and we were fighting there, right, for basic benefits like better wages and pension rights to health and welfare benefits, and yet a year later, this group of workers who the employer did not respect last year, now suddenly they become essential, right? And they're the ones who keep in our communities fed, and it is just so different. But yeah, it has been something that has impacted so fast, to the point where in the mix, right, a lot of the undocumented workers have been lost in the process and don't know really where to go, because suddenly they don't have money to pay their rent, or they don't have food on the table for their families. So it has been absolutely chaos, from the healthcare division that we represent to warehousing, grocery workers. It is definitely chaos. Whether we go into the healthcare industry fighting with hospitals over PPE, where they're calling it proper PPE and claiming that they are providing proper PPE to our membership, but in reality, they're not. What they've done is, due to the fact that the CDC changed the guidelines and relaxed the guidelines in order to allow to have more PPE available, it just puts our membership at a greater danger. Is really what they did. We have reached out to elected officials in the Worcester area to try to help out and make sure that our members are more protected. But unfortunately, a lot of our membership in the healthcare industry had been infected at a higher rate, at about 5 times higher than our grocery workers. Because in our grocery workers, like our local union has about 5,000. And in that group, we only have about 73 that have been infected out of that group. But yet, when I looked at the 25 or 2,200 members that we have in the healthcare industry, that rate is way higher than the grocery workers. So we can see that the proper PPE has not been provided to them. That's just what I have here.
That's a lot. That is a lot. I'm gonna thank you for that. I'm gonna go to Darrin. You want to talk a little bit about some of the things that have been impacting your membership, and what are you hearing, what are you seeing?
Yep. Thanks again, Julia, for putting this forum together. And thanks everyone for joining. And I miss you all, because today we would be on the front line, May Day, rallying somewhere, marching, sounding the alarm. And now we're, having this social distance conversation. But I'm with 1199 SEIU, the largest healthcare workers union on the East Coast, here in Massachusetts, just at 80,000 members. On the East Coast, over 450,000. And our members are everywhere as it relates to healthcare. I want to just use a quote that one of our members have used. It says that my message is to look in the mirror. Caregivers are the cure to this virus. And I think about some of the members in 1199, where we don't just represent nurses, but we represent all healthcare workers, from patient access to environmental services. And what they're experiencing, I'm quite sure you have noticed on the news, when it comes down to nursing homes and how they have been impacted. Our members are right there on the front line providing that service and putting themselves at risk, and doing so because of the lack of PPE that currently our state does not have. We also represent personal care attendants. There's about 55,000 here in Massachusetts. Their employer is the state, but there has not been a production or distribution plan to make sure that those members and individuals have proper PPE so that they're protected while serving a vulnerable population. And also we represent facility workers such as hospitals as well as health centers. And some of our hospitals, where we have membership base, were identified as the first COVID testing spots. Kearney Hospital was identified as the first one. That is directly impacting our membership. Folks have been put on furlough, in different institutions. There's different institutions that have been reusing PPE in an unhealthy and unsanitary manner. And so we're trying to make sure that we're still providing that voice, that advocacy work, and making sure that members are not being taken advantage as they're on the front line providing this care. So it's been very challenging, very emotional, as you hear about some of the consumers that have passed away or members that have passed away because they came in contact with COVID-19. So it's been definitely an emotional experience just in following up and doing member engagement conversations.
I'm going to go to Councilor Edwards, who in many ways, for me has become my go-to for all things that deal with issues of labor and work and particularly the immigrant community, and all things social justice related. So just would love to hear what you've been hearing, what you've been doing. And Darrin did ask a question earlier before we started that I'd love for you to kind of like expand upon in terms of people's rights as we start transitioning back to work, kind of some of your thoughts on that.
You know, I think a lot of people have been overwhelmed by the shock of this. You know, this wasn't, it was 1 week I'm working, the next week I'm not. You know, and it's so intense that most people couldn't adjust financially, couldn't adjust emotionally. And so now, and all of our systems in terms of even just being able to provide recovery or some kind of relief didn't adjust fast enough. So a lot of people were without any kind of real sense of support from local leaders, from the government, from everything. And I think one of the biggest things I've been hearing about, honestly, at first was access to food. The second thing was access to unemployment. You know, honestly, like that system, statewide or even federal, accessing this supplemental relief from the federal government has been, I think, one of the biggest frustrations for most people, that this is supposed to help me in this moment and I don't know how to navigate this. And asking for help consistently, I've been denied, I've gotten this, I've gotten all sorts. So that's where the majority of my calls have been. If it's not about housing, then it's about unemployment and trying to access it or trying to get a decent amount so they can just even basically live. And in terms of like the recovery, I mean, we said it many, many times, the issue is not so much that we don't know what the problems are. COVID did not create these problems. COVID-19, this pandemic did not create most of the problems that we were dealing with. It just threw gasoline on a lot of fires. And so the question for many of us in this space, in the labor space, in the housing space, in all spaces, is how we define this recovery is how we're going to define how we're moving for the next 10 years. We all know how it was before, in many cases wasn't working. Mm-hmm. And so we need to make sure that we hold on to what we had, but also fight for what we should get. Mm-hmm. And a lot of people are going to throw it in our faces. Oh, we're too fragile as an economy. You shouldn't be fighting for those extra benefits. You workers are, we got to do what we got to do to make sure that we can still handle all these things. And that's where we need to stay strong as advocates, as a movement. There are minimums that we need to be fighting for, but they're absolute like maximums and things that we as a just, fair society should be aiming towards. Just to kind of head like 1, 2, 3, 4, and 5, and then I know we still wanted to hear from Jeannie as well. One, never forget that there are some hard fought for minimums that we have, like minimum wage that we have in terms of overtime. And what I feel a lot of employers are going to try and nickel and dime some workers, especially if they're not in a union, to try and get them to work kind of part-time. You were full-time before, but they're going to be part-time now to avoid having to pay for healthcare and all these different kind of loopholes, for the sake of the economic recovery, for the sake of we don't have the money, right? And that's where workers need to stand strong. I believe there's a nationwide strike today. The Walmart workers and some other gig economy workers have said no more. And Amazon workers and some places have stood up and said no more. And it's these moments where the country needs us the most. So we need to say, and we need you as a country and society to raise the standard for us. I think 2 areas where workers will be most in need of their advocacy and in terms of knowledge of their rights, and that's sick leave and workers' comp, especially because we're probably going to deal with a second wave of this COVID-19. And the people need to know the hard fought for rights and sick leave, earned sick time, as we call it in Massachusetts, up to 40 hours. If you have more than 10 employees, it's paid. If you have less, it's unpaid, but it's up to 40 hours a year that you can use for yourself, for your child, and for somebody else to help care for them. And it's important that people understand that right, because I have a feeling a lot of people aren't using it. They're scared to speak up because they're scared to lose what little job that they have, or they're scared that they're going to face retaliation. Again, these are for a lot of workers who aren't of the privilege to be part of these amazing organizations, 1199, UFCW, or 32BJ. But there are a lot of workers who aren't in that quite yet, but will be needing to access this and will need all of our voices to stand strong. So those are just some highlights of some of the major things that we need to make sure workers are aware of as they move forward. We can get to a better world, and if anything, this should be the wake-up call, not the put to sleep moment, but if we weren't woke before, we need to wake up now and fight for that world and use this as the reason, because as I want to say, I think it was Fernando.
Yes.
I think it was you said it, I think in the most, and actually I think Darrin did too. These workers who I felt in too many cases were undervalued and unseen have become the front line to our recovery, literally life and death in their hands. And because of that role reversal, then I think we should leverage that to move, as well as Roxana. I don't want to leave you out, Roxana. The women and men of 32BJ literally are killing this virus every day that they come up to show up to work. So we're the front line. We should be the front line of the movement and the front line in demands for more for all workers. So I'm beyond excited actually about this recovery. This moment is a rebirth of, I think, a new movement.
Oh, yeah.
Amen.
Yeah.
Thank you.
Thank you for that. We're ready. I'm ready to go out right now and start protesting. This is the type of energy that we need in many ways, to right the wrong. And I'm not sure, Councilor Edwards, how long you're going to be able to stay with us. Because I think you might have to leave a little bit earlier, and just let me know so I can make sure that while you're here, we still continue to engage you in the conversation. But I do want to go to Jeannie next, and then I want to be able to ask another question if you're still going to be around. Yeah,
I can go. I will have to leave no later than 6:45. Okay.
Okay, that's good to know. Okay, Jeannie, you're out here in the front lines, literally still right now, doing the work and living this reality. Tell us, what has that been like for you? What are some of the things that you're most concerned about? And talk to us a little bit about the shifts, the changing that's been happening to you. Where are you?
Right now, the changes on the shifts. I started at 8:30 to 5. Then they changed it to 8 to 4:30. Now they changed it today. It's going to be 7:30 to 4. So that's like a wear and tear on my body and on a lot of us, because now we're adjusting, trying to get here. Now it's here. Now it's up and it's down. So a lot of our work is, we're overworked and it's becoming stressful. But we did die down just a little bit. Like you said, Councilman Edward, it's going to be a surge where it's going to go back up. Right now, they changed the shifts because they say they're lack of patients. So far, I think today we've seen maybe 58 patients, and Monday we've seen like 79. So the numbers are dropping, but you can best believe it's going to be a surge and it's going to go back up. A lot of our workers are complaining that we are on the front line. Why can't we get that extra $5 an hour? Because we're on the front line. We're not a nurse. We're not a doctor. But like Darrin said, we're the ones that are hidden behind the scenes. They got to come to us first. I work in one of the COVID testing centers at Boston Medical Center. So that we have to see them, whether we treat every patient as if they're positive. So come out, there's a lot of patients that we have seen who were positive. And then they come back and get tested. So a lot of us is putting their lives on the line. The only covering we have our masks and the gloves. But it's like, this is an everyday thing. So a lot of our members are really, really feeling the stress. They have some family members that passed away. One of the sisters from my church, she passed away from COVID. A good friend of mine passed away from COVID. So it's kind of not just, it's mentally stressful as well as emotionally. So, we're out here battling. And Councilman Edward, I heard when you said something about the 40 hours. A lot of our furloughs are using their earned time. So when they come back, they're not going to have any time if their family members get sick or if they get sick. Is that going to be accessible for them when they come back and have no time? That 40 hours, that
Earned sick time.
Yes, because now a lot of them are using, because they're furloughed, they're using their earned time, and then they're going into their extended sick leave time. So that's going to be when they call us back. A lot of them is not going to have any time to even take, if they get sick, to call out.
Very good point. Thank you very much. And I'll make sure of that, but I think it's also worth noting that if you already have the benefits offered by your job, you don't get extra from this law. So thank you for that clarification. So if you have used through your benefits, you may be out of sick time. And actually, that might be worth us as advocates, Julia, talking to the State House and other people about this. This is a that we didn't plan for sick leave. We planned for it in normal times. We should have assumed that there should be some sort of bank or sick bank for a pandemic. Just some thoughts. Thank you, Jeannie.
Yeah, and one of the things too that Darrin had mentioned as part of this conversation is that there'll be some parents who will be expected to go back to work, but they may not have childcare because the childcare early childhood centers are not going to be open just yet. So what would that look like? Is that something that you can fight against? Would you have to show up to work? What are some of are there any laws or to protect people? Should there be? How's that going to look, Lydia? I mean, Counselor Edwards, when you think about you're not ready to go back to work, but the mandate is that we're opening up the state back and everybody should go back to work whether you can do so or not.
I would imagine that kind of mandate or the opening up of the state does include expanded facilities for childcare workers. Right now, they've been restricted. They're allowed to stay open right now, actually, but it's for only a I think, for first responder and some essential workers, children right now. So they're actually on reduced capacity. I would assume it would have to go hand in hand. As we are opening up the state, we're opening up more positions and places for children. But let's be clear, before COVID, we didn't have enough childcare spots. Okay, just want to make sure we need to advocate, period. We didn't have enough anyway. We were fighting for universal pre-K anyway before COVID, but we will probably be opening up at a capacity at least to get to what we had before, which wasn't enough.
Darrin, you have your hand up.
Yeah, just Counselor Edwards, and thank you for the update. Was wondering, just to expand on the question that Counselor Mejia asked, if individuals are opening up not just childcare, but just the concern of COVID or being exposed and not ready to go back to work, my concern is that employers will take advantage of this and not fire people, but say that they resigned or quit so that they don't have access to unemployment. And that's the concern that I'm having with people being told, Monday you need to start back work, but you were just notified school's not going to be opening up for the rest of the year and you don't have things in place. Do you end up, finding yourself on that side of the situation with your employer?
So that's a great question, because I do think it's the herky-jerk stop where a lot of people are going to find their workers' rights are particularly thrown out the window, right? Because there's going to be a lot more workers than there were positions that are looking for work. We will get played for each other, right? So if you can't do it, I'll find somebody else who can. And then there's also the issue of just general like pressures that they didn't want you there, or you made too much money and this is an opportunity to get rid of you, right? With now your kids and so on and so forth. And I would encourage anybody, especially it's about the care and welfare of a family member, especially if it's about that's the reason why you cannot go to work, that you have different rights under FMLA, you have different rights under sick leave, you have different rights under the new, there's an expansion of paid leave under the federal, you have different rights. So I would actually, make sure that you are very clear with your employer. It's due to the care and welfare of my child that I'm unable to come. Make that clear in writing. Just don't show up. That's the biggest mistake most workers make. They don't communicate. They don't say why. And they don't have a record of when they said why. So the person's just like, you just didn't show up. So communicate. It's for this reason. And then immediately, if you feel any kind of pressure, you need to talk to with either a legal services attorney or get to somebody who can specifically navigate you through the different leaves and rights that you have. They have been expanded and people don't know that.
And you're right.
Go ahead, Fernando.
And you're right about that, Lydia. So under the federal expansion, right, of a family leave, if an employer has under 500, and I believe is over 50, then at that point, if someone was infected with COVID, then they're supposed to pay the 2 weeks. So they shouldn't be depleting the PTO time, right? The earned time that are our folks have out there, they shouldn't. They should be paid out of the employer. It should be taken out of the PTO.
So I have a question, Counselor Edwards. One of the parents that I work with back in the day inboxed me and said that she was concerned about that. She's deemed an essential employee, and she was concerned because she has a baby at home, but that every time she goes to work, she feels like she's putting herself at risk and then her family as well. But that she wanted to talk to her employer so that she can stop working and then be able to collect unemployment. And what I said to her is that she should talk to her employer before she even thinks about leaving the job. But I'm just wondering, what type of advice so you would recommend for her to look into the federal expansion provisions, and then and reiterate that it's because she's putting it's because of her child, the welfare of her child that may be at risk, and it might be okay.
Yes, and I even had a woman who was part of an essential workforce who was pregnant, and that was the advice I gave her too, as well, is to go ahead and look. You, maybe your employer can afford to put profit over people. You cannot. You can fight this fight alive. And so if you're going to have to fight the fight, please protect yourself, protect your children, and you come back for the fight. I will give credit to where credit is due, not just for legal services attorney. That's where I come from. So that's where my heart is, but also to the Attorney General's office. I mean, honestly, you should be seeing this. And I one thing we could advocate for is for the Attorney General's office to get a form up so people can file some complaints about being denied access to their expanded rights and expanded relief. I think that would really help in terms of us organizing and getting to more people in English. And the AG's office is pretty good about having multilingual forms, but a lot of people need to be reporting this issue. I know I have this right to these things, and they need to be able to go ahead and report that to bad actors and other employers who are doing wrong by workers. The other thing too, you and me, Julia, honestly, some of these folks will be the first ones in line for a city contract, city license, city relief, things like that. And I said it before, and it won't make us popular, but we need to, on every single city contract and RFI and request for funding and anything else, there needs to be a box. What did you do during COVID? How are you the best actor that you could be? And were there any complaints filed? How did you treat your workers? And if we have, through all the organizing and the hands, the reaches, and the places that we find out someone did wrong by people in the most vulnerable, we should be fighting like hell to make sure they never get a city contract again.
That's right.
That's $600 million worth of contracts.
And we should add that we're going to put a resolution out there, an ordinance. What we're going to do, Lydia, because I'm all in for that. All these bad actors, and then we put together the list of bad actors and shame them publicly. We're going to take it one step further. We're going to let everybody.
I can't judge. I went outside somebody's house when they didn't pay my nanny client. I was outside a house with a sign. I was like, this person right here, Jack Craney, didn't pay his nanny. And I was out there in Belmont with a bunch of people. So I'm not afraid to put shame on somebody, but we're talking about systemic issues and how we as politicians can move our big money away from people who don't do right. But at the same time, it's a call to action for those who are doing right. They should be rewarded. They should get to the front of the line. So that's what I just want to make sure that we were on that. But I think it would be great to hear from the union reps is, would a form from the AG's office make sense that we could pass amongst membership, pass amongst workers, that they could fill out and file a complaint if they're denied these rights for expanded, relief. I think that I don't know if it's worth it. Maybe it's just too many things.
Roxana, what do you think about that?
So I think, and I want to just in that question, I want to kind of take a step back, just because I think that the question that Darrin had talked about before was about how we're envisioning reopening the economy, right? And when they're talking about reopening the state off of this, I think it's an opportunity, like Lydia said, as far as we're all these workers that have been deemed essential in this moment of time of this crisis, that it is a place where we can make a demand about what does opening up mean for these essential workers, right? And
That's right.
and the demand around the issue of what's the coverage for sick time going to look like? What's the safety requirements that we want as part of opening up the economy? What are we saying that that's the demand of essential pay for workers are going to continue, because even as we open up, right, there's still going to be some high concerns around safety for workers. And I think that if we have a collective ask, right, I mean, I know when this pandemic started, it took a lot of people making a demand on the needs for masks that they finally showed up for some folks, right? And some companies that were saying they couldn't do it finally, came up with them, right? I think that there has to be a loud voice on kind of the key issues that we're seeing affect across a lot of the service frontline workers that have been affected by this pandemic, and will continue to be as we think about reopening. My concern is that I don't know, there's, as the governor, as they're putting together a task force about how to reopen the economy, at the state level, I know I don't see any labor voices like of these essential workers. I don't see them at the table, right? Next to the big biotech company, or next, to a big commercial office real estate person, to actually say this is the things that we need to require or need to put in place as we think about reopening, not just for not just for the general public, but also those workers that are going to continue to serve in a certain capacity to basically help with this crisis. And so I think that is we have to be, have a way in which how does workers, essential workers, get a seat at the table in those conversations. And anything that the city can do to kind of push is there, as they think about task forces to think about reopening the city, how is labor at that table? I know that labor has, more of a voice at the city level than they have at the state level, but in regards to the governor, but I think that we do need to be able to make some demands of how workers will be treated, because we've seen what has been the outcome of the decisions that if it's left employer to employer, it's been across the board, right? And no one is figuring out to do the right thing on their own. And so we need to kind of be able to push for what we think is right, and that to be the call that we make as workers.
I'm gonna go to Janine because I see your hand up, and thank you for that, Roxana. Janine? Or were you just playing? Jeannie, oh my God, why did I Jeannie, ignore me until I get it right. Sorry about that, Jeannie. Jeannie in the bottle. Okay, got it. Jeannie. We can believe you. Okay.
Like I said, I'm on that front line. I'm at Boston Medical Center. Can you hear me?
Yes.
I'm on
Darrin, you're gonna have to speak a little bit loud.
I'm at Boston Medical Center. I've been there for 35 years, and this is I said I've been there for 35 years, and this is I've never seen this before. But we're just, like I said, we're pushing our way through. And my question is, from the members, they're constantly saying, why can't we get that $5 extra an hour? Where unemployed people are getting that extra $600 and they're not on the line. So, Councilman Edwards, I'm speaking because I'm on the front line. Is there anything you can push on that issue regarding our workers that are being paid?
So I'm gonna be I don't know if it was my internet because I've had some spotty issues, but I'm just wondering, Darrin, were you able to Get Jeannie.
I tried to hear it. I just asked her to check her internet. I text her. Just to
I
make
was
sure
able
it
to
connects.
hear.
Oh,
I
perfect,
was able to
Roxana.
hear what she said. I mean, she's basically, what can we do to fight for the essential pay that at BMC they should be, you know, that the workers are asking for. And I think, Jeannie, you're not the only one. Union members and non-union workers alike, right, are fighting, are saying, why don't we have that essential pay, right? Especially just because we're not seeing, you know, what they see as first responders, right? But there's so many people that are risking their lives going to work right now, trying to help with this pandemic in so many ways and not getting that essential pay, or what you'd call hazard pay. So that's what she was asking about.
Councilor Edwards.
Well, I mean, there's always, I mean, maybe this is the kind of advocate or activist in me, but there's always a strike. I mean, I hate to be so direct, but I mean, if the point is pressure points, the point is this isn't just a life and death issue for folks who are in the facility for care. It's about the care workers. So you're going to have to pick a point where you would decide, are they or are they not on the front lines? And if they're on the front lines, then they need to be paid like other frontline workers. They need to get the benefits that other frontline workers get. Even if it's not, you know, even if you weren't planning on this, you can't change the essential functions of a person's job and not compensate for them for that. You can't. And what you've decided is that these folks are so incredibly important right now, and how they're dealing with this, and vital to our recovery. The argument is that you need to compensate them. That's a very simple, what we have said from day one, from all aspects of it. That's what we used when it came to organizing the nannies. It came to organizing any other component. So that may be a last resort. I do think that there's steps in graduating in either letter campaigns, op-eds, and you can elevate this, but I'm already talking to the experts in elevation and organizing. Okay, so I don't need to go through the steps, but I don't need to because I'm you know, I got my little GED, y'all got the PhDs in this, so I'm not even gonna try. But you know, you have advocates in me and Julia, and that story, what you just said, I have not heard enough of. I'll say that. I haven't heard it enough, and I haven't heard it. The media has not focused on that, and that's one of the most frustrating things right now. The media is not doing its job. The media is become a promotional tool for Baker and for, well, the mayor's actually doing some, but for Baker especially, I feel like he's getting away with everything. And so the media is not doing its job and allowing the general public to be enraged by what you just said.
Can I say something in regards to, there's a couple of things, Lydia, early on you had mentioned about maybe pushing the AG's office when it comes down to the PTO, right? How some of these employers are depleting the PTO banks of our members, and they shouldn't be doing that. They should be paying them for those 14 days if someone is out infected. They should be paying them if they don't have childcare. They should be allowing them to go out and take care of the kids. And so I believe that we should, and if I have to send letters to the AG's office, I'll do that because that is not right. And I see that a lot in the healthcare industry. We have manufacturing, we have the grocery employers, and they have been open to pay. They have been open about relaxing policies. If someone is out, just the fact that they're afraid to come to work because they have family members who have underlying health conditions, they have allowed them to go under unemployment. So there are some employers that have been very open to it, but there's others that are not. And I have, in my experience over this whole thing, the healthcare industry has been the worst. And incredibly enough, the nursing homes have been more open to it, to give all the way up to $5 in hazard pay. But yet I have, like UMass Memorial in Worcester, employees thousands and thousands of people, but yet they don't want to do it because they claim, hey, that's what we pay them for. That's why they picked to work in this industry. They knew what they're getting themselves into it. No, they didn't. Nobody knew about this. Okay. And so why should they put their lives and the family's life at risk every single day? And the employer, who has a lot of money in this case, do not want to pay them hazard. And also the $800 million that governor released for the healthcare industry, right? What about that money? What were the conditions on those? You know, so we're saying, well, our members should get a piece of that. You know, and like I said, a lot of our membership in that healthcare industry have been infected at a higher rate than other industries. So we should be joining and pushing the AG's office or anybody that we need to. We also need to support Elizabeth Warren Bill of Rights, right? Because it's asking for this essential employees to get, essential workers in general to get, and first responders to get hazard pay. So we should be behind 100% to get that. There was another, I'm sorry.
Yeah, I know, Fernando, I'm sorry. I know that we're gonna be losing Lydia soon, and I know that Darrin wanted to go next. Darrin, I wanted to just give Councilor Edwards an opportunity.
Of course.
Some closing remarks before she heads off to her next Zoom or next activity. I'll come to you. Okay, Darrin, sorry about that.
No problem.
Thank you so much for this conversation. We're continuing the conversation as well, dealing directly with UI questions tomorrow. We're going to do kind of a town hall and just trying to answer people's questions and trying to navigate the system. It'll be simultaneously translated. And that is just speaks to one, how much our organizing and our outreach to folks has had to change. And then two, I just want to thank my sister in service for allowing me to be part of this conversation. You know, we grow together. So thank you so much for that. Every single one of your unions have been part of my growth, my political career, and my organizing before I was in politics. Every single one of y'all I've had the privilege to work with or know. And so I just have to say to the labor leaders, thank you so much. Thank you for all that you do. This is May Day. This is your day. And this is also our moment. We need to pull back, like Roxana said, figure out the standards, and then say the best world moving forward looks like this. And there is no recovery unless it's at that standard. You know, I'm a soldier with y'all. I'm sorry I have to go early, but but you know I'm never leaving. So take care, everybody. Thank you so much, sis.
Okay.
Thank you.
Thanks, Counselor.
Thank you. Okay, sorry about that, Darrin.
No need to apologies.
I really want to take advantage of Councilor Edwards. She's been such a leader in this space. And so when I asked if she can co-facilitate with me and be in this dialogue, because, you know, like I said, she's running it over here. And so I wanted to take advantage of her time, so.
Oh, no need to apology. And thank you so much for just having her on, you know, and you all working together as an example of what, you know, collective power looks like. So, and just to, you know, reiterate some of the things that others have already highlighted is that, you know, Frontline, there's been several stimulus packages that have been released already, right? And I'm happy to say that one of our federal demands is literally that: how are frontline workers being compensated right now during this time? And how is that legislation on a federal level being influenced by the experiences like members like Jeannie and others will share with them? I think that it's a no-brainer for folks like us, right? That's like, hey, if someone is doing something right now in the midst of this crisis, why are they not being compensated? And if we have already highlighted that the essential worker was less than 6 months ago the low wage worker, still is the low wage worker, how are they now elevated right now, seeing that so many, our nation is dependent upon this population of workers right now? And I think that I'm happy that on Monday, we have a direct action where we're going to be trying to amplify our voices to make that known that we need to have increase in production of life-saving equipment. We need to increase the funding to our state for healthcare providers. So Medicare and Medicaid dollars need to come, because a lot of the institutions that vulnerable populations are going to are DISH hospitals, disproportionate shared facilities. So how are those institutions being reimbursed? Because one thing I have noticed during contract negotiations is management always say they don't have the money, right? They don't have it to be able to provide some of the financial support that these workers deserve. But given what they're experiencing right now, as so many people highlighted, loss of life, putting their own life at risk to care for others that are sick, there has to be some type of appreciation, tangible appreciation, other than, thank you, good job. I know of one institution that gave people Tootsie Pops, and the workers felt disrespected by that, of saying, if this is your way of showing us you appreciate us, it's kind of a hard balance when someone's like, we should just go on strike and see if that. So I do agree with Lydia. I love those tactics, but because of the crisis that we're in, it's a balanced approach, right? If healthcare workers went on strike right now, who's going to be there to care for those that are sick, right? So we have to be responsible in a sense of how we go about, even if we take that form of action, making sure that we are not putting the population at risk that are being cared for either.
Yeah, I just wanted to bring my mom's example into this conversation really quick, as it relates to a lot of the things that we've been talking about. So my mom is a low-wage worker. She's a food handler and has been for the past 20 years at the same college. But the organization that she has been employed under, they were always afraid to become union. And she tried to organize all of her co-workers to become union, but they were so afraid to do so. So that's why the reason is that my mom is 70 years old and she's too poor to retire, because she's never had union representation, right? And so right now they let her go because of COVID-19. And, but while she was employed, they always gave her less hours so that she would never qualify for health insurance. She doesn't have paid vacation or leave. Like for the last 20, she's been working under these really messed up situations for so long that what I hear often is, and this is what I've always said, I don't want to go back to normal, because back to normal was not working for us. What I want to do is I want to move forward, right, and right the wrong. And what opportunities do we have right now to change the working conditions for our people, and to set the stage for how we're going to continue to do business, not just in Boston, across the country. And if it's not through striking, if it's not through just demands, but the fact of the matter is that something has to change.
Absolutely.
We can't let our people go back to these type of working conditions. And if they're being exploited now, like Jeannie is, right? What is it going to look like when we go back, quote to quote, and work, unless we utilize these moments to really organize ourselves? So I just wanted to kind of bring my mom into the conversation, because I want to transition into Immigrant, which is one of the things that I know Roxanne had talked about earlier during our prep. So my mom was once upon a time undocumented, but she had a tax ID, so she was able to work, but she wasn't able to, when it's all said and done, you're not able to collect or benefit from any of the social services that are available to you right now during these COVID times. Is that we have a lot of people who are unable to collect unemployment because of their status. So I'd love for Roxanne, if you can help us understand what is going on for the immigrant community and the impact that this has had.
Well, I think that it's obviously been very difficult. I mean, you can see by the communities that have been hardest hit, right? In our state is, there are largely immigrant communities, people of color, and it's very hard for folks to even you've seen high levels of folks contracting COVID-19 because even their living situation, it's hard for them to social distance. It's, you know, it's hard for, many are still on the front line, so they're coming back and obviously exposing their families. And so that's been very hard for folks to do that. And so the situation is that, you know, there's just a lot of compounding factors that are, you know, hitting a household all at once. Whereas you have, you know, someone that's being laid off, you're having somebody that's has COVID-19, you have all, you know, all in the same household. And, you know, the struggle of not being able, if you're undocumented, not being able to get the unemployment relief. And that is, so, you know, there is efforts like Fernando talked about as far as, you know, organizations that are trying to fill, you know, that hole to the extent that can be. But I know that also there are some state legislators that have put forth a bill at the State House that folks that have an ITIN number, that's how about 40,000 undocumented in Massachusetts have been able to, you know, contribute paying taxes. They are, you know, we want the bill calls for those folks to be able to also in this moment in time be able to collect unemployment. I mean, obviously that's a cost to the state, right? And I know that that's probably what is stalling, you know, the support for this bill. But I think we have to push hard because again, these folks have been contributing years, you know, to paying actually taxes. And again, you know, the government found a way for these folks to pay taxes, yet, you know, they don't have the relief that everybody, you know, that most people are being able to access. And so that is, you know, that is one aspect to this, but there are other issues affecting the immigrant community as far as, again, the amount of, you know, a lot of people are going, like folks have already talked about, Fernando, I think, talked about just people having to feel forced to go to work sick or, you know, because of that loss of pay. So that has compounded and that's where we see this, you know, the hardest hit communities being hit because of all these factors, right? If they don't have the sick time to take off and be healthy, then obviously that affects whole households where they can't easily social distance, and you know, the ways in which they commute to work, all of those affect you know, their you know, their ability to stay safe. And so it is, you know, important that there's voices for these immigrant workers and that we're actually fighting for immigrant rights. And I know it's been very difficult at the federal level. And so really the states can actually, you know, put what I'd call, you know, packages that can of legislation that, and even city, you know, efforts to support undocumented families that actually contribute every day to the economies, to our local economies. And then in all honesty, the work that Darrin talked about in regards at the federal level, right? In this next bailout talk, we're talking about actually all essential workers should be afforded essential pay, that all essential workers should be afforded the proper personal equipment, and it should be required, right? Not a decision whether your employer wants to give it or not. And then also that these employers have access to the amount, the personal protective equipment that, you know, the federal government has to say, you know, we're going to produce this in a way that it can be accessible. And the other issue is just layoff protection. Again, this is, and I think that those three issues will actually, you know, in turn help immigrants, whether they're documented or undocumented, because again, they live in households with their family unit. And, you know, it will be efforts to support them through this pandemic. And so I think that there's definitely things that we could do at the local level, and the state level, and as well as the federal level, to advocate and and really be loud about the need for immigrants and people of color to be, as folks said, not invisible in this moment in time.
Thank you. Thank you for that. I'm going to go to Fernando next. I know I still go to my supermarket. I actually also go to the little bodegas around the way too, just to help keep them open. But what I have seen is that sometimes when you go to certain supermarkets, people are walking in. People are not protecting themselves, so they're putting their employees at risk. And it took a while for all of the supermarkets to take heed to the precautions, like, to provide PPE to their employees. Can you just kind of walk us through
Absolutely.
kind of what that journey
Absolutely.
for your members?
This has been a battle. Thank you, Julia. This has been a battle from day one with the supermarket industry, Stop and Shop, in particular, which have a lot of the market here in Massachusetts. From day one, fighting with them over providing proper PPE to our members, and putting out letters to elected officials to help us out, to advocate and push this company to provide the mask, provide the plexiglass that the company finally put on those stores, to provide gloves to our members. But a lot of things too, though, testing, because we haven't talked too much about testing, because we wanted to make sure that grocery workers will become essential, right? So by becoming essential, therefore, will qualify for other benefits. And that's something that we have been able to accomplish by then being able to be essential. Now they have the rights to be tested if they want to. So all they have to do is go to one of the sites that they're doing the testing, and they can. However, there's other industries like warehousing where they're not doing that. And our members are coming in to work, in many cases sick, because they're afraid one day to work that they miss, they're going to take a hit right on their, their rent or their food that they need to put on the table. And so many times they don't even believe they have COVID. They think they have a cold, or they're afraid because they don't have, enough coverage on the health insurance. So therefore they're concerned about that. So to me, is to continue to advocate that everybody should have the rights to testing, like Somerville, the city of Somerville did, and providing testing to every single person. And that's something that we need to continue to push for, especially in our low income communities where COVID have hit the hardest, right? And we have Chelsea, Rivera, we have some of the places, Dorchester, some of our communities that just hit hard by COVID. But there's also the fact that we have a lot of undocumented families who do not have any income at this time. I would say for the greater Boston area, for instance, I know Somerville, they do have the Somerville, they have a fund, I believe, where if you live in Somerville, you're a resident of Somerville, you can go and apply for $250. If you are a resident of Everett, you can go to La Comunidad Inc. and apply for a $200 check. It's only a one-time check for now, but the agency is working and trying to acquire more funding. Jobs with Justice, Massachusetts Jobs with Justice also doing the same things, right? So we need to be in touch with those community organizations. But the testing, hazard pay, the things that are really important, right? So hazard pay for frontline workers, testing needs to be provided. And I just had a conference call with the mayor of Worcester, Petty, and some of the shop stewards from our hospitals in that area. And I couldn't believe it. He didn't even know that the grocery workers do get tested. Okay, but yet in the hospitals, they don't get tested unless they are showing symptoms of COVID. Then they would send them to testing. Other than that, if I have a member and go to the management and say, I want to be tested today, they don't get tested. And so his claim was that Worcester didn't have enough testing kits, and that's the reason why they couldn't. So how is it possible that we were able to get it for grocery workers? They're all frontline workers, and therefore the state should provide that testing for everybody who is on the front lines.
Thank you for that. I'm gonna go to Jeannie because I know she had her hand up. But I also want to ask you a question, Jeannie. Too, is, you know, as a frontline worker who's interacting with patients on a regular basis, you know, I'd love to hear about what type of testing are you getting on a regular basis, if any, just kind of, you know, that's a question that you can answer after you make the comment that you have, but I'm just intrigued about what your own process has been.
Yes. So at Boston Medical Center, the first thing they do, they go into, like, it's called the blue.
Can't hear Jeannie.
See? Can you hear
Yeah,
me?
that's better. You might have to talk a little bit louder.
Okay. At Boston Medical Center, the first step when they come in is to go to the blue tent. The blue tent then takes their temperature and give them a form. The form then brings them to us, where we register them and ask them questions as if they've been in contact with anyone with the COVID virus. Now, a lot of people might say no, because they ride the bus, they don't know if that person's positive. Even if they don't have symptoms, we still test them. So, Fernando, you can always send them down to Boston Medical because they would still get tested.
Thank you.
Mahia, why have you on? I wanted to ask, I noticed in Somerville and Cambridge, they were finding people if they didn't have masks. Is that going to be the same thing implemented in Boston?
So that's a good question. One of the things we've been having daily conversations with Mayor Walsh. What for us, our biggest concern is around equity and profiling, and making sure that our most vulnerable communities, if we're gonna go into a mandated mode, is that we're able to provide the resources to folks, so that they can have the coverings that they need. I think one of the things is that it's not just about the masks. It's people can also just, you know, right now people are making masks themselves. So it's really about how resourceful people are being too about using the coverings that they have at home. So there is a lot of conversation about how we're going to implement that in a way that is not going to further create financial hardships for folks who are already struggling to make their ends meet because they're not covered, right? So it's really, for us, it's about the implementation of that and what that's going to look like, and making sure that our most vulnerable communities understand it. It's some of the things that we've been, as a council, with the mayor's office, really exploring about. We haven't moved in that direction in terms of mandatory yet, but that is definitely something that if and when it does come down the pipeline, it's more about the implementation.
Right.
So-
also acknowledge that it's hard enough for the PPEs to get supplied to some of our healthcare workers. If they implement that, it's going to be hard for some people that don't make their own masks to get a hold to PPEs. Let's take that into consideration too when you talk to him, because right now.
Yeah. Jeannie, you gotta get your phone fixed, Jeannie. Jeannie, we can't hear you. You know, you got a lot of good things to say, girl. You better fix that situation. We gotta hear you.
I don't know what's going on with my.
I don't either.
There you are.
No, it's the grandkids. They're all jumping on the damn computers at one time.
Get off, because this is an important conversation right now, Jeannie. We can't hear your voice. But
Julie, can I say?
yeah,
Julie,
go ahead.
can I say something in regard to what Jeannie's question was? And this was the mask, right? So because now so many communities have moved and make it a mandate, right, to wear face covering. So we were glad to see the governor coming in today and making that a mandate starting on May 6th, right? That everybody indoors and outdoors, it will be a mandate to have a face covering. And for us, that is really important, again, because it's something that we've been fighting for, to make sure that just like our employers made it mandatory for our folks on the front lines, grocery stores, we want to make sure that customers coming into our stores, they also wear a mask to protect our members. And so we were glad to see that went, did pass and will go into effect on May 6th.
Well, I know that the mayor had a press conference today, And what we here in the city of Boston, we're thinking about the implementation of what that would look like for us on a local level. Because we have been very careful about mandates and things of that nature, because we don't want to, but one of the things that we've been pushing for too is, I always think that we're not, that we could do better at being more culturally competent in terms of our language and what we're communicating to our people. So when we first started talking about social distancing and flattening the curve, I Googled it because I'm like, I don't talk like that. What are they talking about? Flattening the curve, right? I think from the early stages, we were really not communicating in a way that was culturally competent. When we're talking about wearing a mask, right? There's many ways that you could do facial coverings, right? Cover your face. It's all about how we're communicating to communities so that they can understand what the implementation looks like. And I think that is where, for us, or at least for me, a lot of the work that I've been doing is making sure that we're speaking in ways that are easy for our people to understand so that they can heed to some of the things that are coming down the pipeline. Darrin.
Yeah, and thank you so much, Julia, for all you've been doing just by maintaining this level of dialogue right now. I think also one thing that I would, and I think Roxanne, you touched on it earlier in regards to who's a part of these committees, and making sure that we not only have people that are impacted by the decisions that these committees are going to be looking at, but also the cultural side of this, right? Because one thing that has been a little disturbing is a lack of representation when addressing this issue, right? In terms of people of color, even if they're not on the microphone, are they a part of the backdrop to be able to say that we got one of ours in there and they're, signing off on this message that's coming out, right? Because I think oftentimes that's what we keep flagging is that, oh, the governor just created a task force. Well, where is the labor voice on that task force? Where is the, and it's so often like we're talking about communities of color hit hardest by this COVID crisis, but where is the people of color that are around the table around what decisions and what the plans are being? And I know you are there as an elected, but in terms
No. I just wanted to say, no, I'm gonna tell you this. Even I'm not even at all of these tables, okay? Even to get my little scruffy play, no one, look, everyone, and let me just tell you, leadership needs to change, because people define leadership and people define community voice very differently. I have always been pushing, if I want people who are low wage workers, single moms, immigrants, people who are doing the work in these spaces alongside these key decision makers, because our lived experience is very different than even some folks who might be Black or brown. It's the reality, right? So I think I've been really mindful of shifting the conversation. It's going beyond just having racial representation. It's really about socioeconomic status and class and different work industries in these spaces to inform our thinking. So really pushing the mayor and the governor around who's at the table. And I totally agree. And I think that we're at a point right now where we have an opportunity to really set the stage and set our own table about the types of practices that we want to implement and see. But we have to do that as a collective voice. And it includes bringing, Jeannie to the table, your members, the folks who are you all as the representatives of your organizations and your membership, to really help inform what are the things that we need to be fighting for. Because I've always said that nothing about us without us is for us, right? And every single day, right, we're on the dinner menu and we get invited to the dinner table, but we get asked to sit at the kitchen, right? And so we're being eaten up every single day. And so I am really all about shifting the narrative as to who is informing these decision makers about the things that we need to be doing. And I think that's why I've been harping on the cultural competency piece of it, because that is what is missing, is our perspective and our
absolutely.
And the realities that I say our members because I feel like our members are going through, right? And I think that is part of the reason why we wanted to have a conversation today of all days on May Day, right? Because we really wanted to uplift the struggle. But the thing is that this is our moment in time. If we don't change the way we do business right now for the longevity, then we're just gonna go back to the way things used to be, and our people are gonna continue to struggle, you know? So I wanted to, I don't want to get too preachy up in here, because, you know, I'll start a, by the time I get done, I'll start a revolution, y'all. I'm just like Lydia. So, but I do want to, I will always bring in the audience into the conversation. And I know we have, you know, it's 7:16. I love to be able to honor some of the voices that we've been hearing from the outside, to bring them into the space so that we can have a conversation about some of the things that we've been hearing. So I'm just going to read something here that it's a question from Peter. So I'll just read it. He says, "Thank you for this conversation. I agree that reopening and COVID panels should include workers and labor representatives, which is what we were talking about earlier. Should this be extended to employees, to employers? Germany does this, and workers on boards often results in better run employers and companies. Maybe give priority for contractors and economic aid to employers with co-determination." Your thoughts? Your thoughts? That's a lot. I don't know who wants to unpack what, but it seems like I'm not familiar with what Germany does, but apparently the workers and labor representatives are in agreement before. Have you all heard of any of this? I'm not that familiar with what's happening in Germany. Okay,
No.
good. Anyone? I'm glad that I'm not the only one, and you guys are in the movement, so I don't feel so bad.
And maybe if Peter is still on, we can unpack this too, but I think he's focusing on labor management relationships, but extending it to the government. Like, the government is also involved in the dialogue around what is best for not only the employees, but also the employer. So maybe that's what he's referring to. As
And
I'm
if
trying to
someone,
unpack.
Brady, if someone, if you could just send Peter a little thing on the chat to ask him to clarify. But, you know, go ahead, Roxanne. You can unmute yourself, maybe. Don't pull a genie on
Yes.
us.
No, I think that's what he means. Darrin, I think I agree with you that he's relating to the way in which other governments work, where there are actually, you know, these things that we're dealing with, you know, they're actually collectively have already, you know, worked together. And I think the thing is that the employers are being called to be part of some of these task forces. It is, you know, and the fact though is that workers are not being invited into that space, you know, and unfortunately that's how our government works. And so having advocates like yourself and other folks that can actually create spaces that, because we'd be happy to be with other employers in the room trying to figure out what makes sense, not just for how they run their business, but also the impact on workers. But we yet to get that invitation. So we basically have to, you know, demand representation at those tables.
Yeah, or you know what I always said, like, we set our own table. At this point, we're getting to the point where we're gonna have to just set our own table and then invite them to it, right? I think that this is where I talk about shifting, is we create the table, because this is what these times require, is for us to tone in. I wish Jeannie could amplify her voice. Can we hear you, Jeannie? Yeah, we can't hear you still.
Hear me?
Oh yes, okay.
Okay. Yeah.
Okay, we can hear you a little bit more. Okay, good. So I'm going to see if we have any clarifications or anything else from the audience, and I'm going Facebook Live on mine here, too, just because I have a personal page and I have all these pages. I want everybody to be involved in the conversation. It's important. But I would love. I just wanted to make sure that we did cover hazardous pay. We talked about PPE. We talked about immigrant supports. One of the things too that Fernando had talked about earlier on is making sure that we share resources. And I'm going to ask Brady. We have a list of resources for folks who are undocumented, and just links where people can get information. So we'll post that link on our Facebook Live so that people can click it and get information as well for folks. As one of the things that I know that you had mentioned. And then the last piece in terms of just next steps, I think it's okay. I think it would be great if we can get some closing reflections from each of you, and then I would love to be able to loop back with Councilor Edwards to talk about some really concrete next steps that we can take as you know, as a council. But I would I don't remember which order we started in, but I know Councilor Edwards was first, and then I think I went to Roxanne. So why don't you close us out with some closing remarks, things that you want to leave us with?
Yeah, I think first of all, happy May Day to everybody. And I do think that it's important for us this day to honor all those workers that in a few short weeks have lost their lives due to this pandemic. It is, you know, it does elevate the serious nature of what we're talking about in this moment in time. I also think that it just we all need to recommit to fighting like hell for these workers. You know, for Jeannie and her co-workers, for grocery workers, for nursing home workers, for janitors, for security officers. We just have to, immigrants, you know, if there wasn't anything, like you said before, if there wasn't anything that, you know, kept us in this fight, like just seeing what has happened in the last 6 weeks, just I think is a call for everybody just to basically be bolder, be able, you know, not take a step back, make our demands louder. And even when people are telling us to forego wage increases, you know, give back some of our benefits, as what it's happening now in many of our workplaces. We have to feel strong enough to say no, right? And I know that's difficult because, you know, there's a lot of guilt put on, you know, to work that we need to be sharing in the pain of the employer, but like when, you know, we didn't get to share in the prosperity when the employer was, you know, in better circumstances, right? And so it's just, I think that we need to just double down in our commitments and fight for workers. And, you know, this is what this day is about, and we need to carry that forward. Thank you for having me.
Thank you, thank you, thank you, thank you. I think I went next to, was it Darrin that I went to next?
Yeah. Thank you again. Happy May Day to all the viewing audience. This was great. It's been a long week, long day, but just participating in some type of formal dialogue around labor and how we're impacted, it just made it feel like a May Day activity that was somewhat, you know, missing. So thank you again for having this dialogue and hosting this. And one of the things I just want to highlight is that there's going to be an amplified campaign to really make sure that frontline workers of all industries is compensated for the services that they're providing right now. And I would just encourage anyone that's watching to, you know, sign that petition, call your Congress people to just let them know that essential workers need to be compensated. These were the same workers that you didn't want to give a living wage to that are now making sure that the nation is moving forward. What are you going to do for this population, given all that they're doing for us?
Thank you, thank you, thank you, thank you. And then I think I went to June. No, it was Fernando, yes.
Fernando?
All right, well, thank you again, Julia, for putting this together. It's an honor for me to be part of this panel. I want to thank the panel too. It's a great, great panel. And again, it's a pleasure to be with all of you. And I'll tell you that I believe that out of this whole thing, we as a labor movement and workers in general, we need to come out stronger. And yes, you know, some of the employers are already requesting that they want some, they want to take back some of the benefits that we already have, which is outrageous, including in my contracts, Coca-Cola, which is, my God, they're so freaking rich, right? But yet they're already asking to take some of the benefits away. So I say to that, no, we're never gonna do that. This is the time to come out stronger, and together we can do this. So thank you, and happy Workers' Day, International Workers' Day. This is our day, and we honor, of course, the hundreds and many, many workers who have died on the front lines, and the public in general have died. So we honor them on this day. Thank you.
I wanted to just say, you, so far of all of the community conversations that I've hosted, you have the best work office. Home, I don't know if you're at home or what. Like, loving the backdrop. Is that a stress? Is that your home? Is that your office? Where you at?
This is my office at home.
The best home office that I've seen so far.
It was an offer up, okay? Come on.
No, I'm just saying, it's just beautiful. I'm just giving you some
Thanks.
props.
I appreciate that.
Yeah. Jeannie, can we see you? Can we hear you? You better turn on the mic.
It is on.
Yeah.
Ready?
Yes.
All right. First and foremost, I want to tell you thank you. I met you once before down at the Union Hall with Darrin, and you know, we elected you in, which was great, by one vote. So I want to tell people, voting does matter. Your vote does matter. Never say, I don't want to my vote.
No.
Jeannie, your voice.
I'm gonna get you a new phone, Jeannie. Jeannie, fix that phone. We can't hear you.
Hear me?
Yeah, now we can.
No.
So I just want to say thank you. And you guys, I learned a lot that all of you guys are helping to push for us as workers that are on the front line. I want to say thank you to that. And here, thank you. And you all keep fighting for us, because we're out here doing the job. And I want to say to my BMC family, we love you, and don't forget, I haven't forgot about you guys. That's why I'm on this call. So Mahia, thank you.
Thank you, Jeannie, and you're our hero.
Yes. So I just wanted to thank you all for, it's a Friday. Who wants to be on a Zoom call? But it's an opportunity for folks who are not in the labor movement to hear directly from the people who are, and hopefully inspire others to join the fight and to understand that whether we're in it or not, we're all impacted by it. So that whole sense of stronger together, it's about bringing other people into the conversation that are not living your realities every day. So I just want to say thank you so much. You got one more thing to say? Yes.
Remind everybody, it's so important to do the census.
Yes, do the census. That's how we get money into our communities. I really thank you for bringing that up. You can go to census.gov. You should have gotten your code via in your mail. And if not, just go to the website and you can give them a call and figure it out. The census, whether you're undocumented or not, everybody counts, and your information is private for 76 years. So trust that they lead you to believe that you shouldn't take it, but all the reason why more that we should, because we should never trust the institutions that have led us to believe otherwise, because that's every day we don't pull it out, that's one more dollar that we're taking out of our communities. So make sure that you please fill out your census. And Jeannie, you're gonna be my co-host the next time, but you're gonna have to fix your audio. But no, Darrin, thank you for bringing Jeannie along.
No problem.
I think that experience is really important, and you brought that to us. So appreciate you all for taking the time to share with us the realities. And I in terms of next step, Councilor Edwards and I will loop back around on some of the things that we discussed here, and then figuring out how we can continue to amplify all of our voices. And
Thank you so much.
Thank you. Stay
Nice
safe,
seeing
everybody.
everyone. Stay safe.
Okay, bye.
Bye.
Bye-bye.